Hey, good afternoon, everybody. This is Eric with American Business Systems. Want to welcome you to our another webinar, and I appreciate you taking your time out this afternoon. This afternoon for you, if you've never met our CEO, you got an opportunity to meet with him and chat with him this afternoon. So I appreciate you. Let me take this out of this one mode here and put it into a presentation mode so we can all see what's going on here. But I appreciate you joining us here this afternoon. And you're going to get to meet again our CEO, Adam Phillips here. And we're going to have a wonderful time because he's got some great things. He's going to talk about the future of American business systems and obviously the future of medical billing. So appreciate you joining us here this afternoon. He's got a good crowd started already. So again, we're not going to take a lot of time to go through too much of the introduction because some of the introduction is just obviously about Adam here. We'll be going through that here in just a moment. All right, again, for those that have never been on a webinar, you're being requested to find the Q&A box. What I'd like for you to do is, if you don't mind, just put the location where you're calling in from this afternoon. You can put the city and the state if you'd like to, or just the state. It's fine with me. You don't even have to put your name because the name will pop up there. But if you don't mind, that helps me to make sure that you're hearing me and then you kind of engage with us during the presentation throughout the afternoon. So we've got folks here from all over. Looks like Sri is from the McKinney, Texas area. It's good to have you. Sharuz is from Henderson, Nevada. Good to have you. Martin's from Connecticut. Frank is from Florida. Good to have you. Appreciate you people joining in here. Alina from Seattle, Washington. See, folks, now we can say we've got folks here from coast to coast. We've got everybody from Florida to the state of Washington. So, and Alberta, Canada, from Leela. Good to see you. I appreciate you joining. Now, there's some more folks on here that hadn't piped in yet, but if you'd like to do that, please go ahead and just jump on in here and just tell us where you're from. I appreciate it. My name is Eric Oj. I'll be your kind of the co-host this afternoon. I'll be joined here shortly with our CEO here, Adam Phillips. He's going to be sharing a little bit of the story of American Business System. So if you want to know about the history of it, we're going to give a brief overview of that. But Adam's been pretty active here. Matter of fact, he was just telling me about another article that he has been requested to write for the Billing and Coding Advantage magazine. He just had one just recently come out. He had one last year, and he is becoming a great contributing author for this particular magazine. The one that just came out here just a couple of months ago, back in July, he wrote one on specifically on practice management, and it is entitled "The Shrinking Private Practice: Why Billing Expertise Can Be a Lifeline." And we can talk a little bit about that one as well as we kind of go through it. But if you want to take a quick screenshot of that, then you can go find that there and you go read that article. Or if you want to, I'm sure we've got a PDF of that we can get to you. Just reach out to your sales rep. The article that he wrote a couple of years ago, actually just last year, sparked a lot of interest because obviously it's one of the things we're going to be talking about today, the onslaught of artificial intelligence. And he named this one, Will AI Take Over My Job as a Medical Biller or Coder? We're going to briefly talk about that this afternoon. We're going to talk about some other things, obviously, of what's actually happening in medical billing and the future of medical billing and really the great outlook that we have here at American Business Systems. As I mentioned, that he's pretty busy. He's writing not only magazine articles, but he's co-authored a book with Dr. Vicki Rackner. Some of you may remember that I interviewed Dr. Rackner a couple of weeks ago. If you haven't seen that interview, you can go check that out on our YouTube page, and so you can go back and watch that. But you're going to want to go see that. He is also not only our CEO, but he's also the launcher of an organization called the Medical Revenue Management Association of America. That's MIRMA. You can go find that mirma.org. This is the organization that it holds all of the American business systems, independent medical billing companies a part of, and you get to be a part of that as your graduates. Graduating here from your training with us here at American Business Systems. It is MIRMA who is the organization that will actually certify you as a certified medical revenue manager. And you can put the CMRM after your name as your credentials. So, folks, without any further ado, I'm going to ask Adam to join me on video. So, Adam, it's good to see you. Welcome this afternoon.
Hey, Eric. Yeah, thanks for having me on. Excited to be here, excited to chat with everybody. Guys, if you have any questions about this business or the industry, please type them in. We're happy to try to get to all those questions and answer them for you. And excited to talk about the content that we have for you today.
Absolutely. I thought before we talk about the future of medical billing and the future of everything here at American Business Systems, why don't you tell us a little bit of the history of American Business Systems?
Oh, you put that embarrassing photo up there again,
Of
didn't you, Eric?
course.
My goodness. Yeah, so for those of you that don't know the history, I'll just kind of give you a brief history. This is a family business that was founded by my parents. That's my mom and dad in that picture there. They had started this company in 1994. My mom was actually a really good transcriptionist at the time. She was using a typewriter to do transcription for some doctors. And they had a friend who had a durable medical equipment company, selling hospital beds and oxygen tanks and canes and walkers and wheelchairs and whatnot. And he was struggling with his, sending billing into Medicare, and asked her, "Hey, have you ever done medical billing before?" And she said, "No, but I could probably learn it." And so he taught her how to do it, and so she started doing it. And back then, I have memories of my mom filling out claim forms on a typewriter,
Right.
a literal mechanical device that you would hit a key and it would, put a letter onto the the paper there. And if you mess up, you got to either redo the whole thing, or sometimes you can use this stuff called whiteout. I'm sure no one on here knows what that is. Everyone's too young. But that's the way we used to do it before the digital age was born. So that picture is about the time that they had gotten the business going, and that was a vacation we were able to take. And I think that was Universal Studios, I believe.
Yeah, I think
Um,
so.
yeah, so there's a little bit more recent picture of them in our offices that we have here in Keller, Texas. And so, yeah, I came on board a long, long time ago. I've been involved for about 20 years in various capacities. I was mostly in the business development side for many, many years. And then I was president for a little while. And I've been the CEO of the company. I got promoted. I'm the CEO now. I've been the CEO for about 7 or 8 years now, I think. I've lost
Yeah.
track,
Yeah.
but yeah, we're taking it in a really good direction. Every year we are growing. Every year this industry is growing, which we're going to talk about, and it's really exciting the things that are going on, and people that don't have any background in this that are interested in starting their own business can make it work with our help. In fact, I just had an interesting phone call with a gentleman who just joined us. He just finished his third training module today with one of our trainers. I talked to him, and he said he's actually a retired LA police officer. So
Oh,
no
wow.
background in healthcare, never done billing, none of that stuff. And he said, "Adam, you know what I did? I actually went to Chat GPT, and I just typed in my, kind of my background and my skill set." And I basically gave it, 5 or 6 parameters of a business that I'm looking for. And what he typed in was low initial investment, can be run from anywhere, hire staff or run it, solo as a solo operation, quick return on investment, and a growing industry. He typed those in and he said medical billing came up number one.
Wow.
Number
Wow.
one.
Number one?
Number one. That's what he told me.
Wow.
So you guys want to test that? Feel free to go to ChatGPT, type it in, see what happens. I don't know. I mean, that's what he told me. So
That's
I
pretty
believe it.
cool.
I believe it. I mean, there's a lot of flexibility in this business. There's a lot of potential still. So anyway, we can get into it and go from there.
Yeah, well, we talked about this being the future of medical billing, so I just thought I'd ask you the question: what do you foresee as the future of medical billing?
Well, the future looks bright from what I can see. There are a lot of our business owners are really able to take advantage of a lot of the tools and AI, there's a lot of a lot of people are asking about AI and how that works. And so we're going to get into that. We have several slides talking about that. But the technologies and the technology partners that we have engaged with, we are able to stay cutting edge with regard to what the doctors are needing, what's going to really help them be able to focus on practicing medicine and not worrying about the paperwork, not worrying about the administrative burdens. A lot of you may have been seeing the headlines where the term burnout is almost kind of overused now, but doctors really are seeing an increase in feeling burned out, doing their job of running a practice, and it's mainly because of the administrative paperwork and all the other junk that they don't like to do. And
Sure.
so, if we can go and talk with a doctor in private practice and say, look, let us help you analyze your situation, figure out where the trouble spots are. We've got a whole suite of products that we're going to talk about later that can help in a lot of different ways. And that was the one thing that the gentleman said today, the Chat GPT guy that I talked to.
Yeah.
He said, yeah, I was kind of looking in my area. I was doing some Google searching, seeing, if there's medical billing companies. And he said, what I found is, yeah, I found there's medical billing companies in my area, but all they do is one thing. They do billing and that's
Yeah.
it. And that is a helpful service, but the fact that being an ABS business owner, you're going to have a whole suite of revenue cycle
Correct.
products and services and solutions. It really is going to set you apart from what the other folks are doing out there. So, yeah.
All right, so we're going to jump in. We're going to first start off with this whole thing about artificial intelligence, but I want to make sure that we reserve enough time here at the getting towards the end where you can kind of tell us the future of American business systems, what the platforms are doing, because I think we ought to lay this foundation out about, is there advantage of artificial intelligence in healthcare? And then I want you to kind of go into how our technology partners are actually already utilizing it. So let's start there. I'm going to put up on the screen here. This is an article I think that you kind of came across, and it's from a precedent research group, and there's the information, but really artificial intelligence is really what we're starting to see is revolutionizing medical billing process.
Yeah, I mean, if you guys haven't figured it out yet, AI is here to stay and it's getting smarter and smarter and smarter, almost to a level of scariness. I
Yes,
don't, I mean, none of us can see, I don't have a crystal ball. None of us can see where it's going to end up. But it does seem to be rapidly, advancing in every single industry you could possibly imagine. It's
no doubt.
wild. And as you can see there, it streamlines and automates a lot of different tasks, data entry, reduces errors, improves efficiency. But the point that we want to drive home today is it's not smart enough to do it all by itself, and you cannot just like set it and forget it. You know what I mean?
Right.
Especially when it comes to medical billing and coding, there's so many nuances in in the way that this work is done, the way that these claims need to be filled out. There's a lot of human interaction that still needs to be done, even if the AI can analyze everything and put together hey, here's what we think that this should be. You'd
Hmm.
still have to have a human being signing off on it to make sure that it's really going to go through, because if I don't, I mean, I'm paying attention to this stuff all day long. I read articles all day long. There are, situations where people have tried to use fully automated AI tools, and they're seeing an increase in claim denials, an
Sure.
increase. So they're just like, whoa, 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 let's back up a second. We got to still have somebody check in this robot and make sure they're doing what they're supposed to be doing. So I still feel like there's going to be a need for our business owners to be providing services the way that they do to doctors. It's still going to be more efficient and let cost the doctors less money, put more money in their pocket overall if they have somebody outside the office doing all of this billing work and stuff for them. So.
One of the things I think is going to help our ABS business owners is that it's going to help them do a lot of the day in and day out stuff where they thought they might would have had to hire somebody to help them get started or actually do some of the work there. AI is going to really kind of be that part where it's going to really kind of help them stay a little bit more independent and not have to hire somebody too quickly. I saw that Martin took you on your offer there. He put in Chat GPT, gave the list of the five franchises, and American Business Systems was number one. So that's pretty cool.
Well, wait, let's see. It gave me a list of five franchises, and yours was number. Oh, okay. I thought he was talking about just medical billing. I was talking about medical billing as a business was number one, but he's saying we came up number one.
Yeah.
So do I send a check to Martin or do I send a check to ChatGPT? I'm not sure who to
There you
send that
go.
check to.
Make,
Thanks
make a
for
make a deal with Martin there. There you go. Just make a
thanks
deal
for
with
that.
him.
Thanks for testing that for me, Martin. I appreciate
Yeah,
that.
absolutely, man. All right, so you sent me a few articles to post on today, and because not everybody is. I mean, AI is doing a great thing out there, but there's a part where you can't just let it go all the whole. You can't just let it do everything.
Yeah, exactly. And that's we're going to show you several articles that we've run across to kind of back up my statement here. And this is one of them. AI has promise, but health executives are struggling with adoption. And that's the other thing is there's so many different tools and providers, health executives, they're a lot of them are kind of like they're playing the wait and see game. It's
Yeah.
like, this software company wants to charge us, umpteen $1,000 to implement, their AI, tools or whatever. So a lot of them are kind of like holding off to just kind of see where it ends up. Like I mentioned earlier, the early adopters, the ones that are, using these systems that promise you the moon,
Right.
if they're telling you that AI can do it all without any interaction with humans, that's false.
Right.
We were already seeing studies showing that it's actually getting worse for people that are trying to do that. So that's why a lot of them are kind of hanging back. So yeah, that's what that
Yep.
article is about.
And this one was interesting because now it's taking a look from the patient side. This is called the Pew Research Center, and 60% of Americans would be uncomfortable for their provider relying too much on AI. And I thought this was interesting because this is the way I like to kind of talk about it on some of our other webinars, Adam. And because obviously AI has come up in the past, and is this going to take over medical billing? And I said it can't because you're going to lose the relationship between you as a company and the doctor. The doctor wants that relationship just as much as the patient wants a relationship with the doctor. I don't want my doctor relying so much on AI. I want that interaction with that doctor. So I'm using it as a parallel. It's the same thing with doctors and with an outsourced medical billing company. You're going to need to have that engagement with these doctors because again it kind of gets back to the whole thing that people do business with they know, like, and trust. And if everything is just relied upon AI, there's really going to almost say there's no need for a doctor. Just go to a kiosk and put in your symptoms, and hopefully the kiosk and the AI would spit out what's going on with you.
Right, right. Yeah, we got a comment from, hope I'm saying this right, Melchior said AI is not perfect, it makes mistakes. You're
Yes.
exactly right. Now, that actually brings up a good question. I'm wondering if anybody on this webinar has been, required or asked to use AI tools at your current job or your place of business. Type that in. Let me know. Let me know how it's working. If it's working good or if you hate it, if you love it, I'd love to know. I've actually got a buddy who has been a graphic designer for many, many years. We we joke with him that all he does is draw pictures for a living, but I know it's a lot more than that. But at his place of business, his work, they have they've shifted to very heavily using AI, and they actually told him one day in a meeting, they said, "You are no longer a graphic designer, you are a prompt engineer."
Oh, wow.
Yeah, and the prompting is what you type into AI
Sure.
to try to get what you want out of it. Anyway, he's not happy with that at all. He said his job is taking longer now and producing, less quality stuff. And so
Sure.
it's
Yeah.
not there yet. It's not there yet.
It might be good for us who are, very novice in graphic art, and we just might throw something in there, and we can use it here and there. But for real graphic artists, I can't imagine that it's going to replace them either.
Right.
But yeah, so folks, again, with this article, again, you can get a copy of this, just if you want to take a screenshot of this, so you can go back and look at that article, or you can back with your sales rep so they can get you this information. You're going to want to read this information. This is part of your due diligence here. While you're doing that, we mentioned already some other articles, but this is actually a governmental type of article. This is from the National Library of Medicine, and it's a wide known publication. But current applications in artificial intelligence in billing practices and clinical practice plastic surgery. And I pulled out a little bit of that article right here, Adam. And this I think this is telling the whole thing right here.
Yeah, I mean, again, there are ethical considerations, limitations. That's what we've been saying. Now, it does talk about like I said before, in the billing process, automated coding can allow physicians and coders to prioritize complex billing cases, but not completely replace human input.
Yeah.
So that's where we're at. We still need humans.
Yeah, absolutely. Let's see. Are there any questions, folks? Any questions from the audience? I mean, you've got the CEO of American Business Systems. I know that we're going to get a little bit more on the future of American business systems and where we're going in 2026. But if you've got any other questions for him, you can
Yeah,
type that
what
in
what
there.
are you worried about? Anybody on this webinar? What are your concerns about
Yeah.
um, you know, getting into this industry or working with ABS specifically? Please type them in. Happy to answer anything. Totally green. Martin says totally green. I guess that means no healthcare background.
Yeah,
All
probably
right.
so.
Well, you're in the right place.
Yeah, absolutely.
We've designed this for people starting from zero. I say that all the time, but it is true.
Gosh, I just remember when we used to have big trainings at them, and we would go around the room and have everybody introduce themselves and what their backgrounds are. We've had everybody from sales reps of guitar systems and musical systems to
Mhm.
realtors to financial advisors, and rarely did we have anybody that was coming from the healthcare background. Once or twice throughout the year, we would have somebody that came in from there. So, it's not everybody that has a background in healthcare.
That's true. I mean, we are seeing a little bit more these days. I don't know why. I guess people are realizing, hey, I'm doing this work already.
Sure.
Why don't I start my own thing so I can make more money? I mean, it's pretty simple.
Yeah. Yeah. No doubt.
Yeah, I mean, your income is very, very limited. You have a ceiling, working for anyone else. So the only way that you can break through that income ceiling is to start your own business. And yes, it's hard. It's hard work being the owner of a business, but
Hmm.
that's why we're here. That's why we help you every step of the way. Let's see. Layla, I hope I'm saying that right. Layla is a psychotherapist. Okay, Layla, do you
Cool.
do you do your own billing? Do you accept insurance? Do you have someone else doing the billing for you? I'm curious. Mary says, "What's the cost of what you're trying to produce today?" I'm not quite sure what that means. We are going to talk about the investment of the ABS business opportunity, which is what we're talking about today, which is right now, the investment is a one-time investment of 30,000. It does have to be paid up front, and you can make that money back in about a year with just one doctor. So it's pretty good. If I'm not answering what you're asking, please rephrase. Let's see. What about security and privacy concerns? A question from Yvonne. That's a good question. And that's another really great thing that we've taken care of a lot of the back end technical stuff for you. So we have multiple partnerships with different technology companies, and they have their own security divisions. I mean, these companies spend millions of dollars on the security and privacy issue. So they're all completely HIPAA compliant, compliant with government regulations regarding patient data. All these systems are cloud-based, and but they're on redundant servers on different East Coast, West Coast. So the system basically never goes down because there's redundancy in place. They have the same type of security measures in place and even go beyond what banks do for online banking. So if you really want to get into the nerdy, security stuff, we can send you some information on that, and you can check out everything that they've done. But it's just really neat because every morning when you log in, every morning when your doctors log in, your clients, everybody, you've got the latest, greatest version of the system. It's updated constantly for you. So anytime the government comes out with, well, there's a new set of codes,
Right.
we've already put it in the system for you. Well, there's some new payment models. There's some new things that doctors have to do to make sure that they're getting paid what we say that they're going to get paid. And here's a
Right.
checklist that you follow, and it tells you exactly boom, 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 what to do to make sure that those doctors are getting paid the maximum that they can. Hopefully that answered that. Let's see. Frank is asking. Let's talk about investment. I did mention the investment is 30,000. It's a one-time investment up front. Does have to be paid up front before you start the training. Frank is asking, how is the compensation provided? Does your company provide leads to the doctors? So this is your own business. You are truly an independent business owner, and we help you set up your own company name, your own entity, your own logo, your own brand. And the cool thing is we put that on all of the materials that we've already created for you. So we have 10 different website templates that you can choose from, and we include that template for free. You only need to pay for your domain name and hosting, which is pretty cheap. And so whenever you start doing the business and building the business and getting clients, the doctor clients are going to contract directly with you, your company. And we have all of these contracts in place. You basically just fill in the blank with your name, your information, and our team helps you, put together proposals and all kinds of cool stuff, how to price yourself. But when it comes down to it, when you start doing the work for a doctor, they're paying you directly for the work
Right.
that you're doing. It's going straight from their pocket into your pocket. We don't touch your money. And it's roughly, I mean, there's lots of variables, but you're going to be making roughly 6, 7%, anywhere from around 5 to 9% is kind of the range, and that's a percentage of all the collected revenues that you get from the insurance companies for that doctor. You get roughly 5 to 9% of all that. So just as a real ballpark, example, one family doctor, if you just sign up one individual family doctor, you're looking to make maybe 25, 30 grand a year, somewhere around there, for about 1 to 2 hours of work a day. It's not
Yeah.
much. So that very quickly adds up. If you start adding multiple doctors, if you start adding specialists, because you're making a percentage of their revenue. So the specialist doctors, you make more money, so on and so forth. So hopefully that helps that. And as far as leads, yeah, we actually have a very cool way. Now, if you're talking about leads for you, which I'm assuming you're talking about, yes, we actually have a brand new program, by the way. I'm not sure if you're even aware of this, Eric, but we are now including, when people become an ABS business owner, we're including one free year of the Zoho CRM system. So it's actually called Zoho One, which includes their customer relationship manager program, but it also
Cool.
has access to all of their other programs, and they have dozens of different apps, like for invoicing, all kinds of stuff, like a QuickBooks type thing, all kinds of different apps. We give you 1 year of that for free now, included. And so,
Oh, cool.
not only are we doing that, but one of our support team members will actually help them collect leads online. We have various sources for doing that. One of them is the NPI database search,
Yeah.
um, and some different things like that. So we can actually help you gather a list of leads and put them into this Zoho CRM system, and help you create an email marketing campaign that offers lead magnets. What is a lead magnet? Well,
Right.
what we use as lead magnets is ebooks. So we have actually put together right now, specifically, we have four different specialties that we're focusing on: behavioral health, chiropractic, physical therapy, and there's one other one. I always forget what the other one is. I'm drawing a blank, but there's four. And we've written these ebooks that you can offer as a free download to a prospect, a lead, and it gives them information on how to improve their revenues and how to improve their revenue cycle and how to improve their workflow without having to do business with you, without giving you any money or anything. And so guess what? That builds your credibility big time because no other medical billing company is doing stuff like that.
Right.
So that is a new process, a marketing method that we have added to our package. And so there you go. What else we got here, Eric?
Well, I was going to say this what you've said so far has been the worth of being on the webinar today because you did share some new information I hadn't even heard about, which is awesome. So Frank, hopefully that helped answer your question, and that's pretty cool. Let's um, let's just keep taking some more questions, Adam.
Okay. Do you want to answer any, or do you want me to just keep
Let's
going, or
see.
what?
Well, I love it. Sharus, hopefully I said your name correctly, is asking what makes you stand out from other medical billing franchises. Well, first of all, we're not a franchise. We are a business opportunity. So right off the bat, you can eliminate royalty fees and any other kind of franchise fees that go along with it. So there's just the one-time investment of the $30,000, and that includes everything that we've talked about so far. So all the training, the support, the help with the leads so far, everything that you've heard Adam talk about, and then all of the different solutions that we have. I'm going to put that up there too, so you can see that. So all of these different services that we're talking about here is all included. Even when Adam and his team puts new services on, everything that you get in the future, you're going to get without having to pay anything extra. So these are things that one of the things, I mean, gosh, Adam, can you believe it's been over 15, 16 years since I've been a part of you guys?
Yeah.
And, just the opportunity to see adding new services over the years that have just truly helped our business owners become even better. I think, as you mentioned, as this LA police guy here, law enforcement officer, I believe it was, that just said you do more than just medical billing. There's all these different services that you have.
Right. Exactly. Yeah, we've got lots of stuff.
Yep. All right. Let's see. Mary is asking, I have approved and managed $1 million medical claims for Blue Cross Blue Shield of North Carolina. Was laid off years ago when Bob Gretchen was the CEO. How do we get back in this role processing medical claims now? That's a great question. Mary, were you doing medical billing for Blue Cross Blue Shield? I'm not sure if that was. I'm not
Yeah,
sure
I'm not sure that any of that is really
I know that's what
an
I'm saying. I don't
issue
think
at
it's
all. I
relevant.
mean, how do we get back into this role of processing medical claims now? I mean, we have people that are signing up new clients every day for billing. Private practices, we focus very specifically on the small to medium sized private practices. So like 10 doctors in a group or less is kind of the sweet spot for where we market. So if you have any follow up, questions on that, Mary, feel free to type that in.
Yeah, and I think as we're looking through some other ones, Mary, again, just understand that as Adam said, you're doing billing for independent doctors. Uh, Obviously, they're credentialed with several different insurances out there. Medicare is one of them, and all the Medicare Advantage plans that are out there. And so, some might be with that Blue Cross Blue Shield of North Carolina. So we even have a credentialing service that if you got doctors who need more opportunities to see more patients and be a network with different insurances, we actually can help out with that as well.
Yeah.
You mentioned behavioral health, Adam, and it looks like Yvonne works for an agency, so their main concern is affordability. You want to talk about the affordability of doing medical billing for a behavioral health group?
Well, I don't know if it's going to be affordable for them or not until you actually do a practice analysis and sit down with
Ah,
maybe an office manager and try to figure that out. But I can tell you that 9 times out of 10, when we show you how to do this practice analysis that we help you with, we're able to uncover costs, a lot of extra costs that they don't necessarily take into account with how their current setup looks like. And behavioral health, that's one of the specialties that we have an ebook for, and we have a whole marketing process for them. So that one is a really, really good one to market to. So we can certainly help you. But like I said, if you have any contacts there, I would maybe be careful with talking with them before you go through our training, of course. But once you go through our training, it would be a matter of letting someone know, hey, I've got this new office up that we just opened up locally that does billing and revenue cycle management for behavioral health, and I'd like to take a look and see. I don't really want to just say, well, we can do your billing for X amount without having a good picture as to
right.
what's really going on. You end up shooting yourself in the foot a lot of the times that way if you just
Yeah.
throw out well, we'll do it for 6% or
Yeah,
whatever.
right.
Um, so that's one thing that we do is we help you position yourself and we help you with, well, what do I say when they ask this? What do I say when they ask this? To very specifically kind of guide you through the process of closing a deal. So that's what we're good at is we're experts at getting doctors all the way to the finish line to where they're signing a contract with you, and we can help you do that.
Absolutely.
Uh,
Mary's, I kind of read this one here, Adam, and she says many people do not know how to process medical claims as evidenced by some of my family members being sent the bills when they should have been sent to the medical insurance company. That's the problem, Mary. Doctors that have folks in their office maybe don't know how to really do medical billing and do it properly. And so the doctor keeps losing money, and the doctor keeps wondering why they're not getting paid. And that's the whole reason why doctors' advantage is to outsource because they know if they're not getting paid, you're not getting paid. Instead of paying somebody a full-time employee to do something that they're not getting collected on. So, Mary, this is the reason why for outsourced medical billing.
Yeah, and I don't know, specifics on what happened with your family or whatever, but it sounds to me like some of the features of our system would help alleviate
Mhm.
what happened there. We have it sounds like maybe an eligibility check wasn't done or done properly, to see what was actually covered and what wasn't covered, and so that's why, a bill was sent where it shouldn't have been sent. That happens all the time. But our system has a real-time eligibility check feature where not only will it, in real time, before the patient even comes in for their first visit or their follow-up visit, they can do it in the system. They can do an eligibility check and say, hey, here's what we're going to be, talking about. What is their coverage from top to bottom for this patient, and help them kind of estimate who's going to pay for what and how much it's going to be. So those are some patented features that we have in our system. Not only that, but if they're a brand new patient, we can check their eligibility, and then we can also click a button to pull all of their demographic information, their name and address and all that stuff from the insurance company's records and put
Yes.
it into our system so that when it comes time to finally send that claim in at the end of the whole process, we're sending in information that the insurance company has in their file, so they can't deny a claim based on incorrect demographics, which is a very big reason for denied claims. So, Mary, it sounds like you would benefit from seeing a demo of our system. So get back with your ABS rep that you've hopefully been talking to, or if you don't know who that is, you can call our main number and find out. But they can give you a software demo and show you how that works, and it's really cool. Really cool.
Yeah.
Yeah.
Yeah. Awesome. Let's keep
Oh,
you
I
want
did
to keep.
look up the other specialties, by the way. So behavioral health, social workers, physical therapy, and chiropractor. Those are the four that
Okay.
we're focused on right now. The reason why we picked those four, Eric, is because for lack of a better term, they tend to be low-hanging fruit. And what I mean
Sure.
by that is A lot of times they are solo providers doing their own
Yep,
thing by themselves, but a lot of times they actually do go to networking events and
they
special
do.
events that we teach you how to go to meet people. And yes, they are going to be smaller revenue for you. They're not huge, you're not going to make $1 million on one of these doctors. But they are excellent first clients to kind of get your feet wet, figure out how
Sure.
everything works, and hopefully start getting some referrals. We have one of our owners, Jeff Bruner. He signed up a social worker. It went really well. It's very easy work. It's like the same, code number every time on every claim, so it's very easy work. And that social worker referred him to other social workers, and now he's got like a dozen social workers that he's doing
Yeah.
just from referrals from that first one. So
Yeah.
pretty
And
cool.
yeah, I mean, and like you said, if you had a full practice, you're probably spending a couple of hours a day on that one practice, but with a social worker, it may be even less than that. So you can do several at a time without
Yes,
ever having to hire anybody.
exactly.
Yeah. Leela, hope I've said your name correctly also well. I think you said that you're out of Canada. One of my concerns is related to the status of the business as a foreigner and what legislations are applicable.
I'm sorry, I wasn't listening. What was that?
She is out of Canada. So she was, what you're going to need to do, we have people that have done billing out of Canada. You would just need to make sure that you're doing billing for doctors that are in the United States.
We have three brand new business owners that are from Canada right now that are going through
No
training.
kidding.
Yeah, yeah. So the system is meant for U.S. doctors. It's a U.S. coding system, billing system.
Right.
So, you would have to have some type of presence here in the States as far as maybe a business manager that could do the business development and actually do some of the networking and talking with doctors and things that we teach. But the work can be done anywhere in the world as long as you're doing it for U.S. doctors. So again, get with your ABS rep. They can kind of walk you through how that works, but it absolutely can work. Yes.
I went down a little bit. Mary says, thanks for the clarification. She says, cool, thank you. Yvonne says, understandable. So I was just looking down a little bit further because I know that there's a lot of people that put some stuff in here, which is awesome this afternoon. Um, Frank's asking about the Zoho cost after the initial period.
I had to Google it. It's $37 a month, it looks like. 37
There
bucks a month. Yeah. So, and it's completely optional. I mean, you don't have to continue if you don't want to, if you don't feel like it's working for you. But comparably pretty inexpensive. I think Zoho is one of the cheapest ones out there. There's a lot of different CRMs though. Like if you want to switch over to some, there are some that are free, I think.
Sure.
They're not going to be nearly as quality, but you get what you pay for. So,
Yeah, absolutely.
yeah. Do we have any more good slides that we should be going through or?
Yeah, I wanted to, before we wrap up, getting some more questions here, you did write that one article, and I thought we would just touch on that real quickly. And it was the one that you did back last year on advancements in AI take over my job as a medical biller coder. I just wanted to highlight a couple of you got some quotes in here that I think were, again, just because this kind of goes towards Alina because she was asking about the AI ethically, how to use that ethically. So I thought we'd kind of jump back in there just real quickly, and then we need to start wrapping up here. We got about 15 more minutes before the top of the hour.
Yeah, I mean, we can send if you guys want to check this article out, we can send you a PDF of it. I mean, it doesn't sound like people are very concerned. I did see one from Alina. Did we answer that?
We
Those?
haven't answered that one from Lena. I thought it was just a good segue to kind of go back and forth between your article and answering her question here about AI ethically, using AI ethically.
Yeah, I mean, that's exactly what we're trying to drive home is it's not AI doesn't know how to be ethical. Only if the people behind it that built the learning models are ethical. there are some that I think are more ethical than others. Like I think there's one called Grok, which is done by Elon Musk, which is just the wild, wild west. Like it's
Sure.
completely off the rails in my opinion. I
Yes.
haven't actually used it, but things that I've seen, I'm like, okay, wow. Um, so yeah, so biggest Alina was saying the biggest concern is the sales aspect. I've been running a large claims organization. There's no direct sales involved. What's your advice on making that transition to a sales oriented business? Also, can I be provided more information on the operational costs using the software that wasn't clear? I mean, that's something that we teach you in the training is how to, I mean, I'm assuming that you're working for a company and not running your own company right now. I'm not sure on that, but yeah, I mean, we will teach you how to transition yourself from thinking in terms of an employee to a business owner. And the another neat thing is you can do everything yourself, or you can
Mhm.
hire other people to help you with the sales and marketing. Um, so yeah, I mean, that's something that will definitely show you how to transition, to be more sales oriented because it is about sales. I mean, obviously, when you go through this program, this isn't like a janitorial thing where we give you, a school to clean, right out of the gate. It does take some work to get the first contract, but most of our business owners, if they're doing it full time, they're seeing their first clients in 60, 90 days after training, somewhere around there. I mean, of course, there's a lot of variables with that. A
Sure.
lot of people have to start the business part time, which we can definitely show you how to do that as well. A lot of the marketing can be done in the off hours. So if you've got a regular 9 to 5 and you're like, I don't know how I'm going to make this work, a lot of the marketing that we teach can be done in the off hours, like early morning breakfasts, luncheons, things in the
Mhm.
evenings, weekends. So you can make it work if you are determined to make it work, and we're here to help, in every sort of way. As far as operational costs for software, yeah, the research guide that we have, it can be a little bit confusing. There's a lot of different ways to structure it. What we recommend typically is to simply charge uh, to so what you're going to do is every month you're going to send the doctor an invoice for the billing work that you're doing, and we recommend that you just charge that doctor a percentage, and that's it. So you're charging the doctor, let's say 6% for doing the billing work, and built into that 6%, you're basically eating the software cost behind the scenes. And so the doctors don't see any separate line item fees or monthly software fees or anything like that. They just see that 6% and that's it. Um, the software fees are going to vary. We actually have three different software partners. And so, when you read about the iClaim brand, that's a white label brand that we have put on other platforms. Okay. I'm sorry. I thought I was on Do Not Disturb, but I've got all kinds of bells and whistles going off here. Sorry about that. So yeah, so I mean, you can get with your ABS rep, and they can kind of explain the different software platforms that we have, and they're different pricing tiers, and they go from kind of pricey, but you get a whole lot for your money, and to a kind of
Sure.
a mid-level range, all the way to free. So we have a partner that if all the doctor has to do is pay their merchant services fees to this company, which is for credit cards, and there's no other fees at all for using the billing or EHR platform. So it's pretty cool. Very, very,
That
very
is pretty cool.
inexpensive. Yeah. So hopefully that helps there.
Yeah, I was going to add one more thing to Elena. Elena, if you get a chance, go back and I'm going to show you here in a moment to where you can go back and do a little research on our YouTube channel. We just did a kind of a deep dive in how we help you get your first client. You might want to go back and rewatch that. And then if you got any other questions, feel free to get back with your sales rep and then set up a demo so you can see those systems there. That'll be helpful.
Hmm.
Yep. Adam, before we jump in, one more, any more questions here? Uh, we talked about again, what's the future of medical billing? Is there growth in it? So I thought I'd show this one graph here showing the projected growth in
Hmm.
medical billing. You sent this to me, so you want to kind of talk through this. What does this mean here?
I mean, it's pretty self-explanatory. It's all the spending and growth that this industry is showing all the way up to 2034. So we're way down there at 2025 at
Yep.
19 billion, you know. So there's the point with this graph is just to show you that the pie just keeps getting bigger and bigger and bigger and bigger. And if everyone on this, I mean, there's enough pie for everyone on this webinar to get a small little slice of that pie. You know,
Sure.
if you were just to get a microscopic slice of that 50, whatever, 19 billion, 54 billion, I mean, would that be worth it? It's just that there's no end in sight right now from what we can see as far
None.
as yeah, and that's another question that I get a lot is like, isn't this business saturated? Isn't there everybody's doing it? And then you would think that my dad actually when he started this company, he was like, by the year 2000, this is going to be totally saturated. Like that's what he thought.
Yeah.
And what we found is because of several different factors. So because of the growth of the industry, like you see in this chart, but also the fact that our business owners can make six figures with literally just a handful of clients, 4 or 5 doctors, and you're making six figures in this
Yep.
business. Doesn't take a whole lot to get where you want to get, most likely. We're doing an interview coming up in a couple of weeks with a business owner that you're definitely going to want to check out because she has
Sure.
built her business to a seven-figure revenue. She has a
Amazing.
whole team, a whole team. She has hundreds of doctors that she's working with. So that's going to be a good one. Her name's Heather. But yeah, I mean, there's room for everybody in this industry, is my point.
Yeah. I mean, it's amazing. Remember your dad when he would say, "Yeah, folks, you just need a little slice of this pie. That's all you need. Just a little slice is all you're going to need to make a good living out of it."
Yep.
That's pretty cool.